Okay. So, hello, everyone. Hello on a very sunny afternoon of June. So, the Vibe welcomes you to yet another empowering edition, The Vibe Live, a Hexalog. The Vibe, which stands for Women Inspire, Build, and Enhance, is a platform dedicated to fostering women's excellence. It brings together women doctors from diverse specialties to share knowledge, leadership experiences, and personal journeys that inspire both growth as well as collaboration. There are four fundamental pillars that form the Vibe: physical well being, mental health, financial wisdom, and professional excellence. Through its various initiatives, the Vibe strives to build a community of women professionals who uplift one another and redefine the landscape of healthcare leadership. I'm Dr. Ritu Johari, consultant diabetologist and metabolic expert practicing in western suburbs of Mumbai. I have a unique diverse background with decade and a half spent in pharma and now half last decade treating diabetes, thyroid, and obesity. Besides clinical practice, I also contribute to research and medical writing as co-founder of Perfect. But what brings me most pleasure in sharing is the introduction of this exclusive initiative, The Vibe, as a founder of one of its kind platform that targets fostering women excellence. I'm blessed to be complemented by my husband, who's an orthopedic surgeon, and our family feels complete with a teen son and a toddler daughter. With that, let me introduce you to our team Vibe. And before that, a very warm welcome to our star speaker of today, Dr. Kshitija Rao.
Thank you.
Hello, ma'am. And Dr. Lotika, your
Yeah.
introduction, please.
Hello, I'm Dr. Latika Purohit, a diabetologist and a lifestyle medicine physician practicing in Colaba since the last 3 decades. I'm also a visiting faculty at the JJ Group of Hospitals, as well as I'm part of the National Executive Committee of the Research Society for Study of Diabetology in India. And I'm partnered by my husband, who's Dr. Suresh Purohit, also known as the Sugar Doctor, and I'm a mother to an artist and an entrepreneur. The reason you see a fancy background today is because I am here at an event and I've just taken time out to come and participate in the Vibe Hexalog. So with this, I hand over to Dr. Rukaiya for her introduction.
Hello, I'm Dr. Rukia Surya Sheikh. I'm a diabetes, thyroid, and an obesity specialist. I've been practicing in Mulund for the last decade and a half. And the journey has taught that, healthcare is not just about treating numbers because we are diabetologists. It's more about understanding people, how they think, how they sleep, what their lifestyle is. And, that takes them a long way. If I'm not in clinic, I love to work out. I like playing carom, and what brings me most joy are these Wednesdays. For last around 8-9 months that we've been doing it, where we invite an amazing speaker like we have today, and this great company and beautiful conversations which make you think, which make you reflect, and you make you laugh. Lately, I've also started painting, my way of adding little color and calm to the chaos of daily life. Truly excited to be here today. Over to you, Kavita, for your introduction.
Hi, thank you, Dr. Rukia. Good afternoon, Dr. Kshitija. Namaskar, everyone. I'm Dr. Kavita Rane. I've been practicing diabetes and obesity at Rane Hospital in Chembur and Apollo Spectra at Deonar for the past 14 plus years. Apart from diabetes, I have varied interests, creative interests in art, abstract art. I visit art galleries. I've had an exhibition of photography at Jahangir in 2019. So I love travel photography. Me and my father, who's a cardiologist, so we travel. And I love these conversations we have with star speakers like you, ma'am, and all my gang of five, hum panch. And I love them so much. And I'm so excited that I'm going to meet them this Saturday. So over to Dr. Pranjali.
Thank you so much, Kavita. I'm Dr. Pranjali Shah, Director and Chief Diabetologist at Diabetes Clinic. It's in Mulund. I also handle internal operations at iHeal, which is led by my husband. He's Dr. Kaushal Shah. He's a cornea transplant surgeon. Apart from treating young diabetics and help them live stronger and longer, I believe in community medicine creating awareness. So that's why this ACT stand for awareness, prevention, and treatment of diabetes. So we do a lot of awareness camps for prevention of diabetes in schools and the communities. Apart from this, if you don't see me in my clinic, you will see me hiking, working in my farms on weekends, playing badminton with my energetic two boys, and spending time in animal shelters. So, being part of this wide hexalog and learning from inspiring leaders like you, ma'am, this is an amazing Wednesdays we spend in the afternoon, and looking forward for this great session today. Over to you, Dr. Ritu.
What a wonderful group. I'm so excited to talk to you all, and I must talk to you all even beyond this session.
Lovely. Thank you so much. And I'm just going to put you on the spot by saying, how did you feel? We were so privileged that you were a part of our flagship founding event as well in March. So, how did you feel when we invited you for, the Vibe Live, the webinar, the Hexalog today? What was your first feeling?
I was happy to be invited. I felt privileged because there were so many doctors there, who achieved so much. And the fact that, couple of months after the launch, you asked me to be the star speaker. So it's definitely an honor for me. And it's nice because then I get to interact with a smaller group over there. It was
Yes.
wonderful, but obviously with a bigger group, you don't have that one-to-one. So, and now I shall join more of the Wednesday Vibe meetings
Wow.
also, since it's so easy and it's online. So I should make time for that. So you've inspired me to do that now with this invitation.
Thank you so much. That really motivates us to do more. And yes, absolutely. We are so happy that, while we met you at the launch, but we couldn't connect with you. And so we really thought that, we would like to hear your story. And based on your entire charismatic career so far, we actually, jotted down the topic of the new phase of healthy aging, science, self care, and sustainable transformation. So, my dear audience, as we all see, that age is something that is always going to go on the front side. But what if aging wasn't something to fight, but actually something to optimize from? What if the future of health was not measured in how many years you're going to live, but actually in the vitality that is there, or the purpose that you serve, or the quality with which you lead those number of years, whatever the years may be looking like. And today, we're truly delighted to have an expert who helps us to explore the future in this particular direction. So, with your permission, Dr. Kshitija would just like to speak a few words about you. Our guest, Dr. Kshitija Rao, is a physician who spent more than 2 decades helping people redefine health, confidence, and well being inside out. She's a renowned consultant aesthetic physician and a specialist in anti aging and regenerative medicine. An alumna of the prestigious St. GS Medical College and KM Hospital, Mumbai. She's the director of Perfect Image and an internationally recognized faculty member associated with the University of Genoa, Italy. Known for her expertise in facial aesthetics, regenerative therapies, and healthy aging, Dr. Rao believes that true transformation is not about looking younger, it is about feeling healthier, stronger, and more empowered at every stage of life. Through her work, she continues to inspire individuals to embrace science backed self care, sustainable wellness, and the art of aging gracefully. Please join me in welcoming Dr. Kshitija Rao for this Hexalog, The Vibe Live. And without further ado, quickly, Dr. Rukia, over to you for the first segment.
Thank you very much, Ritu. And welcome, Dr. Kshitija, once again. Thank you for accepting our invitation. So, my segment is talking about your journey from anesthesia to aesthetics that you have been. So, you trained as an anesthesiologist at KM Hospital, the prestigious college, wonderful field that you were in, and it's a dream for people to get admissions at institutes like KM Hospital. So, what was this turning point that pulled you towards aesthetics and cosmetology? I think I've always heard anesthetists going into being intensivists, being pain specialists. This was completely taken me by surprise. So, I really want to know, how did you reach there?
So First of all, thank you for having me, and thank you for showing so much interest in what I do and my life. So, let me tell you how this happened, the transition from being an anesthesiologist to aesthetics. It happened quite by chance. And however, I would like to add that I did spend many, many years doing anesthesia. It was
Okay.
not like I finished my MD and immediately. So I finished my MD in 1990, worked in KDM for a long time, then went to UK, worked in the NHS, did my FRCA there. And then in 2009, while I was practicing anesthesia, while I had gone to anesthetize for a dear friend of mine, she was a gynecologist. I don't know, people in Chembur must be knowing Dr. Mandakini Parihar. She's no more with us. But her husband just by chance asked me, would you like to help me set up a cosmetic clinic? And would you like to invest in one? We'll have doctors and we'll just sort of be the behind the scenes people. And when I, explored and we went looking at equipment and looking at techniques and procedures, and the whole thing attracted me. I said, I've done my bit in anesthesia. I've done a lot of anesthesia now. Why don't I get actively involved instead of just being a silent partner? And that's how my journey in aesthetics started. And in fact, Mandakini used to always tell her husband Anand, you took away my anesthetist and you started her in a different direction. But yes, that was the turning point, and that's how it all began.
Wonderful, yeah, actually, sometimes we do feel that, oh, it's the same monotony which is going on. We've been doing the same thing all the time. So it was great that you accepted it as a challenge and you have beautifully, taken it up under your wings and flourished with it, absolutely. So from
I'm
being an
enjoying it.
invest, yeah, from being an investor that you started it as, but now you are actually a doer over there. So wonderful. Ma'am, you've practiced over 35 years. Okay. So how have you feel, this field of cosmetic medicine change when you started, say 2009, when it was Madhuri Dixit to now Deepika Padukone? How has the cosmetic medicine changed?
All medical practice has changed, hasn't it? I mean, I'm sure all of you can vouch for that. But
True.
in cosmetic practice, there has been quite a transformation in the sense people are now quite open to, talking about doing procedures. Initially, it was all very harsh, harsh. It was all about saying, I eat healthy, I do yoga, all those kind of things. But now people do talk about treatments. It's even the common people who are doing it. It's no longer just the domain of the elite or celebrities anymore. You have people from all walks of life coming to me wanting to do treatments, aware of skin health, looking good. And I think one of the reasons for that is that nobody's retiring anymore. you know you're working in organizations where you're working with younger people, so obviously that pressure is there to be young, look younger, be fresh. You don't want to be considered like an old fuddy duddy kind of person. So since there's no retirement age, we definitely want to keep up with younger colleagues. Also, women having more financial independence, they're taking decisions where they would like to spend their money. And yeah, so it's definitely become more open and more acceptable. And there is a lot more awareness that, it's not just about looking good, it's about being healthy from within. And it's a more holistic approach that we're giving now. Also, the
True.
change that I've seen from 2009 to now is that there are more men also walking into cosmetic clinics. Initially, I would have some wife bringing the husband, and you'd be sitting there with this deadpan expression. And I'd say, yeah, so how can I help you? And he'd say, I don't know, she dragged me here. That kind of a thing. But now you
Right.
have men who come in and say, I have this pigmentation, I have hair fall, I have these lines, wrinkles. What can I do to look better for my age? So that's definitely been quite a jump.
Right. Right. I think, yeah, people would earlier go to a dermatologist, generally younger women, where they have this, they would get pimples and they would go for acne. And I think the elderly woman would just go to the salon for a facial.
I think that was all about skincare. That was all. Nobody thought about aging. Anti-aging is and like you are now such a specialist with regenerative medicine, how to keep your skin healthy. And yes, it's taken quite some time, I think, for me also to tell my husband that please at least use a sunscreen. And now he'll be like, Acha, even I want to use, give me your sunscreen, when we are going out, so that, he doesn't want the tan. So yes, men have also changed in that front, that they are also more aware about, how their skin is behaving. Ma'am, about your clinic, you've built this perfect image that you call, which is an independent practice in Mumbai. What were the early challenges of setting up a cosmetology clinic, when this field wasn't as mainstream as it is now, which is dermatology is there, but now there is also cosmetology, which is per se a absolutely precise medicine in its own way.
So there were challenges. One, because in cosmetic medicine, you have to market yourself quite actively. And as doctors, we're not used to putting ourselves out there or blowing your own trumpet, so to say. So it was very difficult initially to be doing active marketing. And also marketing was only by means of newspapers or magazines, where everything was quite expensive. We didn't have social media where you could put forth your ideas, or you could explain to people what aesthetic medicine is, as opposed to going to a salon for a facial. So marketing it was difficult. Secondly, there were fewer players in the industry. So equipment was very expensive. There was high investment in that. And also, thirdly, it was considered very what should I say, like a parlor or a high-end salon kind of thing. People really didn't give it the respect as a medical clinic as much as they do now. Now they do understand. So the challenges were putting across that, this is medical treatments, which is different. Secondly, marketing it among the general public, because back then there was no word of mouth that got you patients. Like I said, nobody ever said that, oh, our skin is looking good or our hair is looking good because we've done these treatments. They always attributed it to healthy lifestyle and other things, nutrition and all. So since there was no word of mouth, it became very challenging to get a constant stream of patients walking into the clinic for treatment. But yeah, now with social media and all, it's definitely much more easier for the younger generation and for newer doctors to be able to market cosmetics as a profession.
Right.
Aesthetic is what I would
Yeah,
say.
I think the doctors are very poor at marketing. I guess that's why probably Instagram is flooded with influencers, because they are giving half knowledge. If I think the doctors come out and speak, the knowledge openly, at least people out there will be, having the right kind of knowledge which is needed. So a lot of time this, because of this, they also get false or half knowledge, which can get dangerous. Ma'am, one last quick one liner. Your clinic mantra is everyone should notice, but no one should know. Can you tell us what that philosophy means in the way you treat your patients?
Basically, I like to give my patients very natural, subtle results. And when I say everyone should notice, no one should know, means they should notice that you look good. They should notice that you look fresh, that your skin is good, or your overall persona is pleasant. But they should not be able to point out and say which treatment has been done. Like for example, if somebody has under eye dark circles, hollows, and we do an under eye filler. But if it's not well done, if the face looks puffy and somebody says, oh, you've done an under eye filler, it looks good, it still means it's not done well, because all these things should be subtle. So that's why I mean, everyone should notice, no one should know. No one should know what's being done. In fact, to give you an example, I have this patient who's been coming to me for the last 15 years, and she's now over 70 years old. And, some time back, she came to me and she said, doctor, we recently had a school reunion. And one of my school friends from back then, she came up to me and she said, I need to look at your watch. So she said, why? So it looks like your watch has stood still. Time has stood still for you. So she said, I looked youngest in my group. My skin looked best, so I looked fresh and radiant. But nobody could tell what was done. So that is what I mean by everyone should notice, no one should know.
I agree. I happened to open today on social media and I came across Sushmita Sen talking. And the first thing, otherwise, she's such a wonderful speaker, and you are in awe of how she talks. But I was all the time concentrating on how her looks have completely changed. You know, I guess, yes, no one should know is also very important when people are taking care of their skin and health. It was wonderful talking to you, Dr. Kshitija. And your journey has been I think I would just take by this that yeah, take those chances and take up challenges when they come. You don't know where life leads you. So it was so wonderful talking to you. Over to you, Dr. Kavita, for your segment.
Before we shift to Kavita,
Yes. Ma'am, tell me.
like my daughter, when people ask, if my daughter is around and people ask, how do you change from anesthesia to aesthetics? My daughter says, Mom loves to talk, and she found that under anesthesia, patients never talk to her. So she moved to a more talking segment of patients. So that's not true. But yeah, I mean, that's a way of putting it in a funny way.
Nice, nice, wonderful. But you must be so good with needles and injections because you've trained with
True. Yeah,
anesthesia. So
yeah.
I'm sure when you're taking care and giving those injections, you teach. Oftenly, the patients must be telling you, "आपका हाथ इतना हल्का है, हमको लगा
You're
ही
right.
नहीं, पता ही नहीं चला."
You're right.
So moving on. Thank you, Dr. Rukia. Good afternoon, ma'am. So before moving on to the next segment, I remember one of the anesthetists where we studied at DY Patil. They say, "हम पर्दे के पीछे वाले डॉक्टर हैं, हम आगे आके डॉक्टर से पेशेंट से बात नहीं करते." That's what it reminded me of what you said. But so moving on to the next segment, this is on the science of looking good. So let's demystify Botox for our audience. Who is it actually for, and what are the most common myths you bust in your consultation room?
Botox, as we all know, basically botulinum toxin. It's called Botox because it was patented by Allergan, but there are many such toxins in practice. Botox is the most famous one. As you all know, Botox works at the neuromuscular junction. It prevents muscle contraction by blocking. It's a whole process, but in short, it prevents muscle contraction. So when you say who is it for, there are medical indications and there are the aesthetic indications. As you all know, Botox came into practice, for muscle spasticity, for
Yeah.
blepharospasm, for migraines, chronic
Yeah.
pain,
Yeah.
trigger points where there's
Mhm.
muscle tension. So
Mhm.
all these medical indications are for those who need it, irrespective of the age. But apart from the known cosmetic indications like, frown lines, crow's feet, forehead wrinkles, even in aesthetic practice, there are other indications of Botox which are not known so well. And one is hyperhidrosis, axillary hyperhidrosis, palmar hyperhidrosis.
Yeah.
People having
Yeah.
this condition know
Sweat.
how
Yes.
difficult it is,
Yeah.
Okay. You go for an interview and you're sweating in your armpits.
Sweating.
It's not a very
Mm.
pleasant sight. And the
True.
advantage of this kind of Botox, it gives you, great results, long-term results. So there's hyperhidrosis, there's migraine. Then apart from the upper face Botox, which is US FDA approved, there are other off-label indications like, jawline chiseling. Like if somebody is young, but they have a bulky face and they want to have a sharper jawline, then you inject Botox in the neck muscles, like the platysma muscles, which is called the Nefertiti lift. Then Botox can be used even to slim the nose. It can be used for a gummy smile. It can be also used for the neck bands. It can be used in micro doses for fine lines and wrinkles of the neck. So there are lots of other lesser known indications. So there's no age that we start Botox at because it depends on who needs it. And with all these
Right.
indications, you can take a guess that it can be from the age of even 15 for muscle spasticity or hyperhidrosis to the age of
Yeah.
70 for the traditional lines, wrinkles, and anti-aging effect. So it's really for anybody who needs it.
True. Absolutely, ma'am. And these myths definitely need to be busted when they come for the first time or they have their own doubts, and you're clearing them out for them, which is really great. So, moving on to the next question, your expertise in Botox and fillers led you to conduct a training program for dentists accredited by the University of Genoa, Italy. Why do you think dentists are uniquely positioned for facial aesthetics?
So yes, when I train dentists, I do find that it's easier for them to inject, but I didn't really go into it actively. I was giving a lecture at a conference in Agra, and there was the dean of the university from Italy, and he was a dentist, and he just sort of said, "Let's run through this idea. Let's try and train dentists because one is they need a holistic approach because when you're doing smile design or you're doing veneers, no
Yeah.
matter how great your teeth, if your perioral area is not good,
Mm,
if it's got
mm,
lines, wrinkles, or cavities, so to
true.
say, the patient is not going to be happy. And
Yeah.
in Italy and other European countries, dentists are allowed to inject Botox and fillers, but they're allowed to inject it in the lower face. Now, of course, when they are trained, they do go beyond the lower face, but then that's what happens everywhere. But officially, yes, they can treat the lower face. Dentists already know facial anatomy. I mean, it's there in their mind every time they're practicing. They are used to giving injections into the face, into the oral cavity. They already have patients in front of them. They don't have to go looking for patients. They already have patients with dental problems. They have patients who are coming to them for other issues. So I find that dentists being trained to do Botox and fillers is great because they can give a holistic approach. And it's like you have a great painting and you hang it up, but you don't have a good frame. It's still not going to look enhanced and beautiful. I mean, a lot of you are artists, so you can understand that how important a good frame is also to a great
Yeah.
piece of art.
Yeah, definitely. Definitely. What you're saying is like a actual framing of the smile.
Exactly.
And that's exactly that's the area where dentists function. They progress and they promote smile. So it makes perfect sense for what you're promoting through dentists. So fillers, threads, lasers, PRP. There's so much noise. How does a woman in her 30s and 40s know what she actually needs versus what's being oversold to her?
And get confusing because every 6 months there's something new coming up.
Yeah.
But I think a good consultation is very important because these are not decisions that the patient must make, like what is good for me. Unfortunately, a lot of them pre-decide before coming to you because of everything like you
Yeah,
said,
they are
every
Google
influencer.
doctors.
Yeah,
Yeah.
exactly. And so many people, oh, my friend did this, so it should work for me. It doesn't work that way.
No,
But
doesn't matter.
see, if you look at aging, right, it's multifactorial, right? There are different aspects of aging. So what happens extrinsic when we age? Our skin starts sagging, we get fine lines, wrinkles, collagen goes down drastically. Our facial fat pads actually shrink, so there's hollowing. Then the what we call the triangle of beauty, which is like this. It becomes an inverted triangle. So you have the base down. So this all this gets very bulky.
Yeah.
When aging is multifactorial, then obviously the solution cannot be one.
Yeah.
So that's why there are
Has to be
multiple
holistic.
solutions for different parts of and different aspects of aging. Like if you have sagging of the skin, then a head lift or something which is called high intensity focused ultrasound would work. It would help to lift the sag. If you've lost weight suddenly, being on a crash diet or, with this Bonjaro and Ozempic and everything, you've lost your facial fat pads, then what you need is fillers. So volume loss is tackled with fillers. Sagging is tackled with thread lifts.
Yeah.
Then thirdly, if you develop lines and wrinkles, crow's feet, frown lines, blunting of the jawline, then obviously you need Botox for that. So, and then, like I explained to my patients, like when you build a house, there are two aspects. There is the structure and the texture. Right? The structure is columns and pillars, and the texture is painting and polishing. So, structure is corrected by the deeper treatments. It's corrected by thread lift, Botox, fillers, high intensity focused ultrasound. And once you deal with the structure and you make the structure solid,
Stronger.
then you talk about painting and polishing, which
Mm.
at which time you talk about lasers, chemical peels, skin boosters. So everything has to be done in a holistic way. You can't have the structure and not have the texture. You can't have the texture and have a poor structure. So though there are multiple treatments, you have to plan it in such a way that each one enhances the other. So it's not one treatment that's going to solve all the problems of aging, but packaging them together in the right way is going to give you the best results.
That is very true, ma'am. What you're talking about a structure, that is, the base has to be strong. Only then will all the polishing and the accessory
Exactly. Yeah.
methods help in the way the person envisions themselves to look, isn't it? So I think you answered my next question, which was how much does weight, nutrition, and metabolism actually show up on a person's face, and is skin health really an inside job? So,
Definitely, definitely, there is a big role to play, whereas nutrition, metabolism, weight, everything is concerned. But
mm,
and like what I explained to you about facial fat
mm,
pads. Now, as you
mm,
get older,
mm.
right, you start losing facial fat pads.
Yeah,
So a
yeah.
fuller face would make an older person look younger, if you get
Mm,
what I mean. So
mm,
if you're
mm,
trying to lose too much weight after a certain age, it is going to show on your face. So I
mm,
have patients, who work out in the gym, they diet, they exercise, and like if you look at their body, they're in perfect shape, but the face looks gaunt, it looks tired.
mm,
So
mm,
obviously,
yeah.
as you get older, you don't have to aim for a very thin face. Little bit
Mm,
of
correct.
fullness always
Yeah.
gives youth. And if you see younger people, you see children, they have that full facial features, a little bit of plumpness also gives a much more younger look. And of
True.
course, nutrition plays a very, very important role. Eating the right kind of food, fruits, vegetables, the right kind of combination of foods, like your omega-3 rich foods which are rich in antioxidants. So your nutrition plays a role. Also, adequate amount of sleep,
Mm,
rest. People
right.
forget rest and sleep is something which is very essential for
True.
repair. Like our
Mm,
skin repair, if I don't know if you know it, but the best repair happens between 11 p.m. and 4 a.m. So around that
mm,
time, if you're asleep, you're going to repair better at the cellular level. But if you're,
mm,
on the phone, scrolling, exposed to blue light, or you're farting, or you're not,
true.
at your maximum rest, your cellular repair is going to be not going to be optimal. So all these things make a difference. And of course, a happy, smiling face is the most attractive face. So, your mental health also plays a role in,
Yeah, very
having that
true.
attractiveness. So,
Yeah,
I mean, we all know how happy faces look. The only
yeah.
time happy faces are not, so to say, promoted is on the ramp. If you see, I've always
Mm.
wondered why the fashion models on the ramp are
That's
always
my.
stern and grumpy. And then I have my own theory. I thought, if they're smiling and looking pretty, maybe you look
Yeah,
at the face and not look at the dress. So they probably want you to not
that's
look
it.
at the happy face, but look at the dress instead. So that's a constant feature, isn't it? A
True.
non-smiling ramp model.
True, true, true. My gosh, you're so observant. I just had
Wonder why
one
that.
time. Yeah, I had this one tiny query. What about people who say creatine and collagen for the skin? Is that better or does it have no effect on the skin?
No, no. So collagen is like the cement between bricks face. You know?
Mm,
And as the cement starts uh, going down, obviously there's sagging. So you're asking me about oral collagen, or you're asking me
Oral
about
collagen.
collagen?
Yeah, oral collagen.
So oral collagen is not completely absorbed from the body, but it helps in when you take it along with vitamin C. Then there is some amount of collagen banking that takes place. But nowadays we talk of the term of collagen banking. It's like putting money in a bank account when your earnings are high. So we talk about collagen banking at an early age by doing treatments which aid collagen banking. So when you reach your 40s and 50s, when your natural collagen is going down, there's a little bit of surplus of collagen in your body. So the effects of aging are not so obvious.
Okay.
But yeah,
Wow.
oral collagen supplements do have a small role to play if you're doing everything else along with it, not just solely taking oral collagen supplements.
Sure, sure. That was really insightful. Thank you very much. Moving on to the next segment with Dr. Ritu. Thanks, ma'am.
Thank you so much, Dr. Kavita. I think, I also had that, couple of patients asking me about collagen. Madam, mere skin pe aapko lagta hai kya? And then I had to tell them that, you know what, I'm not the right person for you to ask, this. But now at least I know that I have some knowledge about it. Thank you so much, Dr. Kshitija, for letting us know. And of course, then we know how to refer the patient back to you.
Also,
Uh,
important to know that collagen creams really are not that effective because collagen is a very large molecular weight ingredient. Doesn't really penetrate through the skin unless it's in nanotechnology and really in micro particle size.
Thank you. I think, and especially in today's day, when everything is about marketing gimmick, it's so essential that we really know how to decipher what is being sold to you is how true, and I was just talking to some other people also the other day that everything you see on the internet, there is such mammoth information. Please, unless you rely the source, do not go by it, because not everything that you see is going to be telling you the truth. Like earlier, there was Google. Google would lead every time everyone to cancer. Now there's Chat GPT. Chat GPT will give you, I don't know, I don't want to even go there. So it's great that we are also learning from each other so that we know that how to balance out these kind of questions. So with that, my segment now, Dr. Kshitija talks about women aging and the confidence conversation, which is of course, very personal when it comes to women, how they look, what is their appearance. No matter we feel that, we don't judge, but we do judge and we get judged all the time. Maybe once, there was a time when men used to not be judged. Today, even, we see men getting judged as well. And then, of course, it's about empowerment, that how you look brings in a lot of confidence and makes that person also relatable with the current trends, whether it is the OTT versions of some, serials, or if it is movies coming up, it's their own friend circle, the kitty circle, or their professional circle. Everybody talks about these things. And now, my question to you is, you've been featured in Femina, Cosmopolitan, India Today, Bombay Times, and you've always had a very long, strong voice in mainstream media talking of beauty. And, has the conversation around the procedures also become more honest, or do you think that women still are confused in today's era?
So that's a very relevant question, in today's times. Yeah, there is definitely more honesty now because there is more information both to the doctor and to the recipient, that is the patient. So you cannot just be giving them a whole plethora of treatments just because you feel that this is there in my clinic and I it's part of my services, so I need to give it. Definitely, there's more honesty because people are aware, so you have no choice but to be honest. And secondly, you have to deal with people's unrealistic expectations. So you have to be very honest in telling them what will work, what will not work, what to expect at the end of the day, and what is impossible to correct. So if you tell them in advance, they're prepared for it. But if you give them some sort of, rosy picture that, once you do this, all these treatments, you're going to look like you're in your 50s, but you're going to look like a 20-year-old. And, you're going to look like so and so celebrity. Because many times they bring photographs of celebrities and say, I want to look like this.
Mm-hmm. My
You have
God.
to sort of, rein them in. It's like having a little overactive child who keeps running, and you have to keep pulling them back in to reality. And this is reality. It's not just about, it's about your inner confidence. Because there are women who come to me who are really, smart looking. They're great looking. They really don't have to have low confidence. But they have low confidence. And these are the ones, like, which we call body dysmorphia. And they're the ones
Mm.
who need counseling too. So it's not just about, it's my responsibility towards them is not just about making them look better, but making them feel better from within also. Because I
Right.
cannot capitalize on their insecurities, that would
True.
be really bad from a ethical point of view, and I would not be comfortable doing that. So there are times when you have to refuse them treatments, and you have to tell them first, like, get your confidence through other means, like go for counseling and get that sorted out, and then we can do treatments. Because as a doctor, you're responsible for their overall well-being, right? Not just the texture of their skin or the the shape of their lips or the shape of their face. So
Right.
yes, it's very important to honestly deal with expectations of patients. At least I do that in my practice.
That is amazing because I totally, completely understand the way you're saying because, it's a very fine line. When we say that, oh, if I look good, I will be more confident versus you're actually living in, an unrealistic world where you want to become like an X person or Y, celebrity, and you're not happy with what you have. So I guess that's the difficult part of the conversation, which I'm sure you navigate beautifully with your patients. So that was brilliant. So the next question was a woman physician yourself. And this is the tricky part of it. I still remember when we were students and we used to think about our professors like that. And today also when patients come to me, they ask those kind of questions. Now you being in this aesthetic field, do you feel you're also subjected to that pressure that that you have to look the part, you have to look beautiful, you have to look perfect, so that people also expect to get those procedures done? How do you balance that personally?
Yeah, there is professional pressure. There is definitely, because if you're talking about good skin, healthy skin,
Yes.
then it's not. It doesn't give a good impression if your own skin is not healthy or good. I mean, it
Absolutely.
need not be perfect, but it has to
Yes.
be the best for your condition, your age, your lifestyle. Like what we say, you have to be the best version of yourself. You don't have to be perfect, because
True.
there is, beauty in imperfection also. But professional
Absolutely.
pressure is there to take care of your, your skin, your hair, your appearance. You can't be shabby, or you can't be, unaware of, what are the latest trends. So yeah, you do have to keep up as professional pressure. Let me give you an example. A few years back, I had a hysterectomy. I had even the ovaries. So it was
Yeah.
like a sudden chemical menopause. So I had a lot of hair thinning. 3-4 months after my procedure.
Yes.
And I had put out a post on Instagram about hair, procedures like PRP and
Hmm.
other stem cells for hair growth. And in
Hmm.
one of the comments, somebody had written, "Look at your own hair and then talk." You know, so that's like what we call trolling. Now, I was obviously
Yeah.
above 50 and mature
Yeah.
enough to handle trolling, but it still
Right.
hurt, and it still made me think that people do expect you to be perfect when you're talking about something. So that is definitely, it's there. The pressure is there. So let me show you if I can find on the phone that photograph of my
Ma'am,
face.
next time, just block them. They are not worth it. You're doing such an amazing job. Just block
Yeah.
them.
Can you see this photograph?
Yeah.
So
Yes.
this was
Ma'am,
the
to the a little to
situation.
the other side. Can't see the
Huh?
screen. A little to this side. Yeah, this side. Yeah. No, it's gone. It's
It's
gone.
stuff. Yeah.
It's
Yeah.
Oh, okay, okay, all
the
right.
screen has shut
So, but
off.
you
Yeah.
might be seeing it ulta.
Oh, yeah, yeah, yeah,
And it's
yeah.
okay. We can make out, yeah, what you're trying to
Yeah,
tell.
true.
Yeah. So that's how, that's the whole professional pressure.
Completely agree with what you just said, and that was absolutely the basis of my question. So thank you for sharing. It takes guts to share these kind of examples, Dr. Kshitija, out, because yes, one is that while we say we have digitalized, we've gone ahead, we've progressed, but these are the nuances which actually we can't control, because people sitting behind the devices and behind these anonymous accounts are
Hmm.
nobody but those dark people who are just removing their frustration. Unfortunately, that's where we should empathize with them. And I don't think I would like to even spend my time over there. You pretty maturely you handle them very well. But yes, I do again come back to the question that yes, it matters. Today, when I talk to a patient and tell them, hey, look, you know what, you should take GLP-1. The first thing they tell me is, oh, you lost weight. Did you take it? And sometimes I do say, yeah, I did. Why not? And I mean, I do practice what I preach. So if
Yeah.
I am doing something, I do it. When I tell them about food, they ask me that, oh, we saw you that day, but you were here till 3 o'clock. When did you have lunch? So these kind of questions do crop up when we tell them about exercise. They ask me, oh man, do you also get time to exercise? And I have to tell them that yes, there was a time where I did not. So yes, we are also subject to imperfection. I'm not saying I'm perfect. There was a phase of my life where I did not exercise, but now I'm exercising and I know what brunts I faced of while not exercising. So yes, these professional issues are something, the pressures are there for us. And they constantly remind us that yes, we need to take self care and we need to be there out in the front. that's
True.
that's the profession that we are in. So if we practice what we preach, of course our patients are also very well convinced. So thank you for promoting that for us. So the last question, at what age do you think women should start thinking about preventive skincare versus corrective treatments?
So, our skin aging starts in our late 20s. So at 25, you would see a sample of the skin under the microscope. You would see less, collagen going down. You would see more of ground substance. So there is aging at the cellular level from 25. So skincare routine, like, simple things like healthy diet, hydration, healthy food, using sunscreen, using some hydrating ingredients. All that should start from your 20s, like 25, 26 onwards. Corrective treatments, again, like I said, there's no age. If you have some particular problem that needs correction, you would even like somebody has very thin lips or a gummy smile. You're awkward about it, you're not confident. So even if you're 20, you start. But for people who don't have, problem skin, then corrective treatments should at least start between 35 and 40. Things like collagen banking, chemical peels, microdermabrasion, basically what we call minimally invasive treatments that are
Right.
going to help you age better.
Wonderful.
Like not,
Wonderful.
you can't stop aging, but you can just
Right.
age better.
That's a beautiful one. I think I'll stick on with that and soak it in for some time and pass on the baton to Dr. Lotika for the next segment.
Thank you, Dr. Ritu. So now is my segment is more about professional insights, the clinic, the craft, and the future. So you, Dr. Kshitija, have conducted workshops on Botox and fillers all across various cities in the country, whether it's Mumbai, Agra, Nagpur, Trivandrum, different at tier one, tier two cities. What is the biggest skill gap that you see in the doctors who enter the aesthetics?
Does entering specifically aesthetic medicine, you're asking?
Yeah, aesthetic medicine.
So I find that, the younger generation who are plunging straight into aesthetics after doing, maybe MBBS or dermatology or anything, they tend to forget that aesthetics is a medical field, you know. So when you have a patient who comes in, for example, if you're going to be doing dermal fillers or you're going to be doing Botox, I have seen when they consult, the patient comes in and says, I have under eye dark circles, I have under eye hollows, I have lines. They say, oh yeah, for your under eye dark circles, we can do fillers, or for the lines and wrinkles, we can do Botox. But the main thing is you've forgotten that you're a medical professional sitting there in front of a patient. So your history taking, your family history, medical history, history of other medical conditions, history of allergy, history of previous surgery, all these things, certain blood tests, workup in terms of certain investigations, all these things are needed whether your patient is an aesthetic patient or a regular medical patient. So that's where I find there's a gap in the sense that do not forget that you're a medical doctor and the person coming to you is a patient. So there are some clinics, aesthetic clinics where they don't call them patients, they call them clients. And I really don't subscribe to that term because it takes away from you being a doctor. So once you call your patient a client, then what are you? I feel that being a doctor, whoever comes to me is a patient. They may not be a sick or an ill patient, but they're still a patient. And I find that when you deal with it like that, you stay within your medical perspective and you stop behaving like a glorified salon or, like what should I say, a spa. So the skill gap is in forgetting you're a medical professional.
That's true. I mean, we should see them as patients rather than as clients and do a complete workup before we do any other process with them. So, tell me, non-surgical facelifts, liquid facelifts, muscle toning, these are all part of your service list. Are we at a point where surgery is becoming truly optional for most patients?
Surgery was always optional. There are very few people who are, willing to go under the knife easily. You know, there are definitely more invasive treatments now that may have taken away about, I would say, 20 to 25% of surgical indications. So
Yes.
there are, there are deep lasers, good penetrating wavelength, and which also help in tightening, toning. Then there is
Yeah.
what we call regenerative medicine. Nowadays we're not just talking about anti-aging; we're talking about regenerative medicine. So you have
Yes.
ingredients and molecules like exosomes.
Mm.
You have what we call polydeoxyribonucleotides, polynucleotides. So the PDRN, which is trending a lot, is the Samuel's
Mm.
DNA. So all this regenerative medicine, when it started well in time, people will find that they will need less surgical options later on because they are already doing what we call collagen banking. They're doing cellular
Yeah.
regeneration, repair at the cellular level before the damage
Yeah.
actually
So,
takes place. So yes, surgery about 20 to 25% has lessened. But having said
okay.
that, even if somebody has surgery, it doesn't mean that's the end of your aesthetic journey because maintenance
Okay.
is always needed. Whether you've done a surgery or done a non-surgical procedure. So even after a surgery, you do need to do things like PRP, which is growth factor concentrate injections, or you will
Okay.
still need PDRN. Even if you've done a hair transplant, you still need to do treatments that will maintain the health of your hair in the long run. So it's not going to replace, one is not going to replace the other significantly.
That's nice. In today's times, with the AI skin analysis tools which are there, as well as at-home devices which are currently flooding the market, what is the role of a physician cosmetologist in the next decade? How do you see that?
I think as doctors, we will always be relevant because, the whole doctor-patient relationship is something that is very personal. It's bond building, rapport building. So that definitely will be there. But yes, AI will help us as a tool in diagnosis, in planning treatments, in probably even
So,
prescribing certain treatments and medications to patients. Will help in us understanding the patient and the patient understanding procedures. AI definitely
yeah.
intelligently has a significant role to play. But again, a word of caution, AI cannot replace, and everything that AI says should not be taken as the gospel truth. I was
True.
reading this article somewhere, I don't know whether it was in one of the Southeast Asian countries, where a young guy, he put on chat GPT that I am tired of life and I want to commit suicide. What should I do? So AI replied that 20 meters from your house is the tallest building. You can go there and jump from there. That would be the best way to commit suicide. So AI and all these things, they have no emotion, they don't have reasoning. So you have to
Yeah.
always take all AI
True.
guidance with a pinch of salt, or rather a whole
Yes.
handful or a bucket of salt. So it
Yeah,
should
yeah.
be
No.
used, but
Recently,
intelligently and wisely.
yeah, recently there was a disease which had been created by AI in the papers. In some papers there was a disease which had been created by AI by ChatGPT, and the references all were not actual listed things. So I guess sometimes AI can be very crazy,
Very
especially
scary, right?
always verify with the other
Yeah.
sources. Yeah. So a quick one-liner. What is the treatment that is criminally underrated? Uh, what do you think is a treatment that is underrated in your field?
So I would say the humble chemical peel, which is a
Okay.
simple application procedure. So there are different types of peels. There are glycolic peels for pigmentation,
Okay.
lactic peel for hydration, salicylic for acne and oily skin. It's a 10-minute
Okay.
procedure. It's
And
really cheap and reasonable, and
okay.
it's definitely underrated because it's not one of the top brand type of treatments, not the elite kind of treatments. But
Okay.
people
And
doing
what
chemical peels
what
have
on the
great
other
results.
hand, what would be the treatment which you think is overrated,
I
very
would say
overhyped?
I would say a thread lift because
Okay.
people expect and people talk of great lifting power and
Okay.
almost like a surgical facelift and all.
Okay.
But a thread lift has a lot of limitations, and I think it's a little overhyped.
Okay, that's very interesting. Now I hand over to Dr. Pranjali for her segment.
Thank you.
Thank you so much, Dr. Lotika, and thank you so much, Dr. Kshitija, for the lovely messages and insightful discussion what we are sharing today. So my next segment is segment 5 is about audience ask, which is becoming a popular segment in our Vibe with Zalog. So my first question to you is, what's the one thing you wish every woman knew about her skin before she turns 40? And for us, it should be, now it is late for us. So give us more tips, like after 40 also what we should do.
Basically, it's consistent, regular skincare. Being very consistent with your sunscreen, your hydrating agents. Retinol use is very good as an anti-aging ingredient. Then some treatments, basically minimally invasive treatments that help in collagen banking. A healthy lifestyle, good sleep, exercise, core strengthening, everything, and a great attitude. All these things will help you in the long run, give you a nice holistic approach to great looks and great skin.
So, ma'am, this retinol cream that normally they prescribe at night, you should apply or something. So, is this really work like in the skin routine? We should do it.
Yes, retinol is great as an antioxidant. It helps in exfoliation. It helps in cell turnover. Helps in collagen building collagen and strengthening the skin barrier. We say you should
Okay.
always apply it at night because otherwise, in the daytime, it makes the skin photosensitive. So you
Okay.
might, when you have UV ray exposure and you've applied retinol, there'll be redness, inflammation. You might get more pigmentation because of that. So retinol, and like I said, repair is always at night. When you're applying anything that's going to help to repair your skin, it's best to apply it at night when
Nice.
your other hormones are also helping in repair of the skin.
Okay. Okay. Thank you so much, ma'am. And is there anything you personally would never do to your skin or your face?
And a lot of things, almost everything. But it's not a technique or a treatment that I would personally not do. but I would personally not do anything that's permanent on my face. Like I would not do something like a permanent lip filler or a permanent eyebrow position. Because what happens as we age, the dynamics, our face is dynamic, right? It's not a static entity of our body. So our dynamics change, our lifestyle changes, our phase of life changes, our attitude changes, thinking changes. So, like if I'm 35 years old and I've done this permanent lip treatment, which gives me these pouty, sexy, sensuous lips, and I'm a 75-year-old grandmother, it's just not going to be in sync with my lifestyle, right? So I would not
Yes.
do anything permanent ever.
Yes. And ma'am, one more question, like we see in our practice from my side now, like when we start patients on, when we advise GLP-1 therapies for weight loss. So the first question, patient comes to us and they say, no, we don't want to have Karan Johar, face.
So
So what precautions or what routine we can advise to our patient along with the supplements?
collagen banking is very important. Treatments like, growth factor concentrate, which is done through PRP, which is called the vampire facelift, because that helps in, keeping your collagen intact and actually building collagen. Then
Oh,
treatments like dermal fillers, they've already lost and they're losing facial fat, then dermal fillers help. And good nutrition, like that, you must be definitely advising them. But basically, anything that will help in collagen stimulation and in restoring lost volume to the face would be dermal fillers or skin boosters like PDRN and exosomes, which again help in cellular repair.
okay. So ma'am, this treatment which you're telling, that should be done in the clinic, right?
Yes, yes,
We
yes.
should send it to the patient.
Yeah, yeah. So if they're losing facial fat, then you do need some minimally invasive treatments. Just applications of creams and all are not going to help.
Okay. Yeah. Thank you so much, ma'am. And now next we are moving to our pulse of life, which is rapid fire round, and where you need to answer without thinking, quick, straight from your heart.
Short,
I'll be
short
asked
answers.
one word without
Okay.
thinking, straight from your heart. Yes, ma'am.
Okay.
So, ma'am, my first question to you is Botox or fillers? If you could only one, which one would you suggest?
Botox.
Botox. Ma'am, sunscreen in Mumbai, 30 or SPF 50?
50 because people don't apply adequate amounts, they don't apply often enough.
Okay, and how frequently we should use it? I'm just
Every 4 hours.
every 4 hours. Okay. Morning skin routine, two-step or 10?
Two
Sorry, ma'am?
steps.
Okay. One skincare ingredient everyone should use, and one ingredient that's overrated.
The ingredient that everyone should use is a hydrating ingredient like sodium hyaluronate, not really hyaluronic acid, but sodium hyaluronate, which has a low molecular weight, which hydrates the skin. Because hydrated skin is the best skin. And what is the second part?
And one ingredient that's overrated.
Overrated. I would say
Yeah.
something like vitamin C is really overrated.
Okay. Ma'am, your guilty pleasure snack that your skin probably hates.
French fries with peri peri, maybe the salt in it would make me have water retention, puff up next day, so my skin would not thank me for it. But at that moment, it was fun.
Yes. Amazing, ma'am. If you could change your skin, which animal, bird, or insect would you like to be?
If I had to change my skin regularly, the best animal would be to be a snake. Shed off the old skin and get
You
new
can
skin
change
every season. What more do you want? You don't want anything else apart from getting new skin. That would be the best.
Yes, yes, ma'am. Given a chance to choose your career once again, but accept medical profession, which would it would be?
Yes, I wanted to do home science and catering. But
Wow.
that was my second choice if I didn't get the marks for medicine in 12th. I was a little disappointed I got the marks.
But, super, ma'am. Aging gracefully versus aging on your own terms. Pick one.
Aging gracefully on your own terms, not or.
Yes, yes, true, ma'am. The best compliment a patient ever gave you.
There have been many, but I think the best compliments my patients give me is that you're very honest in your consultations. And the best compliment my students give me is that you're very generous with your knowledge. You don't hold anything back. So those
Yeah,
are the best compliments.
true, true, ma'am. Super. So that was so sharp, sincere, and so authentic. Just vibe stands for, ma'am. And it was lovely interacting with you. Over to you, Dr. Rukia, for the closing.
Thank you, Dr.
Thank
Kshitija.
you.
As we close today our Vibe Exalogue, one thing stands out, which I think your students have pointed out really well, is that you are absolutely generous about your knowledge. And in this 1 hour, also, you have, told us the myths, cleared our concepts, told which things are relevant, and, some which are fads, and how one should look after their health, and starting from an early age on, and you can age on your own terms. So I think, yes, that's wonderful, ma'am. Thank you so much for
Thank
sharing your
you.
knowledge, your insights, and also inspiring us to have some skin routine on a day-to-day basis. And I guess Vibe is going to come all of us together to your clinic to
Well,
have one
most
session.
welcome. You're most welcome. I shall serve you French fries.
Wonderful. Ma'am, thank you so much. So, ma'am, if when history remembers your contribution to women's health, what do you hope it says about you?
Help women and men to be happy within, to be happy from within and from the outside.
Yes, I think I will not forget this, that why models don't smile, because otherwise people will look at their faces and not look at the clothes. So,
My theories may not be right.
yeah, no, but whatever. So we had been to Jaisalmer and there was a photo shoot which was happening. My daughter was 10-year-old, and we were all in awe looking at the photo shoot for the first time, and she said, suddenly everyone is quiet, and she just says, why is nobody smiling? And everyone, just bursted out laughing, and it was like, yeah, it was a good
The
capture what they had.
honesty of an innocent child.
Yes. Because otherwise, when we tell the children to take pictures with us, they're like, smile, don't make your
Exactly.
face, you smile, and stand properly, look in the front. And here they were all looking at different places and having this, just,
Glaring at you,
yeah,
literally.
I'm sure. It was wonderful having you with us. And I would like, as we do, each one tells what they have had their learnings of this today. Let's start with Ritu.
My God, the moment you put me on spot, the first I'm like, oh my God, I have to cut myself because I speak so much. But I will start by saying that first thing is, Dr. Kshitija, I love one fact about you when you said that I speak a lot and I love talking. And I think I relate completely with you. And, in my school, in my college, everybody used to say, इसको last में chance देना क्योंकि ये इतना बोलेगी कि हमारे सारे points खा जाएगी और हमको time भी नहीं मिलेगा. So I religiously always try to go last. But however, I will just stick to one point today, that I really love the honesty which you bring to the table. Especially the thing that stuck with me real good is, when patients come to you with unrealistic expectations, you still want to call them back and say that, hey, look, it's not that just because I'm here for services, I will give you everything under the sun, because money making is not what actually gives you satisfaction. It's the skill and the result which gives you that particular honor. So really, I think that honesty which you bring about is what really touched me, and I feel that is what we should give to our patients as well, that whenever we are treating patients, look at them and tell them from the start that what is it that they want to do, and help them accept what they are. Because like you said, a smiling face, that is what is going to bring the entire gleam or the beam out in the room. So unless you're happy with what you have, no matter how much ever you may do with the cosmetics or procedures, you will not be able to be happy, because you're not open to accepting it. So thank you so much for that.
Thank you.
I was precise.
Thank you, Ritu. Let's have Kavita.
Yeah, I agree with what Dr. Ritu was saying. That honesty towards your patient is what you mentioned and what we totally resonate with. And the other thing that I really like what you said is first improve the patient's self confidence. बात उधर से शुरू होती है और फिर बाहर आती है, like it comes externally from inside. So the one inside matters. Just like for all your skin treatments and for our obesity treatments as well, it is the same thing. तुमने वजन कम कर लिया, still you're not looking pretty, or someone is having an issue with a selfie, don't take a photo from this side, that side. It really doesn't matter until you work
True.
from within. So I really resonate with that, man. So over to Dr. Pranjali.
Yeah, so there's so many things I've learned, and those are new things for me today, like collagen banking, which I've never heard before. So definitely I'll explore and I'll come back to you for the same. And
Yeah.
I frankly, I have never done anything. I think I was not aware also. So definitely I'll come to you and to understand after 40 now what all skincare routine I should be working on it. So that's my main thing, ma'am. And thank you so much for sharing and making us aware, because I think we were only not aware what we are doing with our skin. So yes, so we should come back to you, ma'am. Over to you, Dr. Lutika.
So you shared so many things, but what I liked was that you shared that to us as doctors, people who we treat are our patients.
That's stuck.
Lotika is stuck.
Network
She
issues.
was bringing up the point of the client, the terminology which you mentioned, that when it is patients, it's patients. It cannot be clients, because you're not commercial. Sorry, Lotika, I'm taking up your privilege
Yeah.
of saying that up, but I think yes, that does matter a lot, Dr. Kshitija, and speaks highly of your generosity again and character. So
Yes.
lovely.
Yes. So
And
like she
I
said,
also want to take this opportunity, guys, that, since we have Dr. Kshitija here, maybe when September or December, one of the quarterly events, we would love to have a short talk by you on, the skincare routine, on for at and especially
40
when you
and
said
above. For women
14 above,
doctors,
and
just
what
as
was the
as
2025, yeah. I don't think that our India or the women around do know that skincare should start at 2025. I'm sure the mothers are still, telling their daughters, hey, look, you are still, young, don't do anything to
Yeah,
your skin. So I think that is
exactly.
where we need to spread awareness. So if we
Awareness.
can do something with Dr. Kshitija, I think that will be great for all our peers, so that they
right,
can then, percolate it down to the other women as well, non-medical.
right. And
You know?
even for
So,
us, we are doctors. We just get a wash our face. Sunscreen अभी ये सिखा दिया है तो sunscreen लगा के जाना है clinic पे lipstick लगाओ and हम चले गए.
I
So
don't even put sunscreen. I shouldn't be
and
saying that here, but yeah, I will
come
have to.
back home in the evening and you just wash your face and you go off to sleep. That's about it.
I'm
So
sure no one reapplies the sunscreen after 4 hours.
no,
You should,
Nobody,
yeah,
nobody.
yeah.
because it
I mean,
stops being effective after 4 hours.
But ma'am,
and in
isn't it a challenge to apply it over the makeup?
You get sunscreens with makeup also, but you can apply over the makeup. No problem. It's better than nothing, right?
Yeah,
And
true.
tinted sunscreens also, which look like foundation now.
Hmm.
Yeah.
I
I'm very
still
true. I
remember
mean,
when
that is one
So
thing I've been using since the age of 29, sunscreen.
so
And
not
it
just
really
water
has.
break girls, also sunscreen bakes. So
Yeah.
that's important.
That's true.
And
Sunscreen.
moisturizer. I think that is one thing,
Yeah,
like you
like I
mentioned,
said,
hydration. We do not.
hydration.
I think that is one thing we do not. It's not as much spoken like sunscreen is. and everyone is applying, but hydration is something, moisturizing is something which we don't do it enough. Yeah.
And with the
Totally agree.
pollution and everything, it just saps your natural oils. Plus, we don't eat that much ghee, butter, and all now. So your natural
Yeah,
oil-water balance of the skin is lost.
Right.
absolutely.
Thank you. Thank you so much, Dr. Kshitija. And we end this with our signature, where we join our hands and make we two, which make a W. W for wife, W for women, W for vibing. So we, and on the count of three, we say be the vibe. Okay. So 1, 2, 3. Be the
Be the
vibe.
vibe.
The vibe.
Thank you.
Thank
Thank
you
you
so
so
much.
Thank you
much.
so much,
Thank you so
Dr.
much.
Kshitija.
And one line I would like
We
to
hope.
say, which I
Did you
tell
like?
everyone, is you never get a second chance to make a first impression.
Wow,
Wow.
I love that
Cool,
line.
cool.
I'm gonna copy
Thank
that.
you.
Thank you.
Yeah.
Thank you so much.
Super. I hope
Bye,
you had fun too.
everyone.
Bye.
Yeah.
Bye. Thank you so
Ma'am,
much.
come
Bye.
on Saturday. Ma'am, come on Saturday. Come
I'm
to the
sending
event
you
on
the
Saturday.
invite.
You have
I'm
to.
sending you.
I
We'd
will
love
try.
you to
I
have.
have some out of town patients, but let me see how I can squeeze it in. Thank you.
Sure.